Download this code from codegive.com, link in the description below. Medical Coding Tutorial, CPT Code Lookup for Septal Button. Introduction to Medical Coding. Medical coding is the process of converting healthcare diagnoses, procedures, medical services, and equipment into universal medical alphanumeric codes. These codes are used for billing, insurance reimbursement, and maintaining patient records. The most commonly used coding systems include ICD, International Classification of Diseases, used for diagnoses. CPT, Current Procedural Terminology, used for procedures and services. HCPCS, Healthcare Common Procedure Coding System, used for supplies, equipment, and certain services not covered by CPT codes. Understanding the septal button. A septal button is a medical device used to close a defect in the septum, the wall dividing the left and right sides of the heart. This procedure is commonly performed in patients with conditions such as atrial septal defect, ASD. The closure can be done using various methods, including surgical techniques or percutaneous, non-surgical, approaches with the help of devices like septal buttons. CPT code lookup for septal button procedure. When coding for a septal button insertion, you would typically look for codes related to cardiac procedures, specifically those that address septal defects. CPT codes for septal button procedures. 1 CPT 93580, this code is used for the transcatheter closure of a septal defect using a device such as a septal button. It covers the procedure where a catheter is used to place the device within the heart to close an ASD. 2 CPT 93458, this code is for catheterization of the heart, which may be relevant if the procedure involves imaging or other interventions during the placement of a septal button. Example of coding a septal button procedure. Scenario: a 32-year-old patient presents with a significant atrial septal defect. After assessing the patient's condition through echocardiography and catheterization, a decision is made to place a septal button to close the defect. Procedure: the patient is taken to the catheterization lab. Under sedation, a catheter is inserted into the femoral vein and advanced to the right atrium. The defect is measured, and a septal button is placed to close the atrial septal defect. CPT coding example. CPT code 93580, transcatheter closure of atrial septal defect using a septal button. This would be the primary code for the procedure performed. CPT code 93458, if catheterization imaging was performed during the procedure, this code could be used as well. Modifiers: depending on the situation, you may need to apply modifiers. For example, modifier -52, if the procedure was partially reduced, example only one side of the defect was closed. Modifier -59, if the procedure was performed on a different site or a separate session. Conclusion: understanding how to properly code for procedures involving septal buttons is essential for accurate billing and reimbursement. Remember to always verify the latest CPT codes and guidelines, as they can change over time. When in doubt, consulting the American Medical Association CPT codebook or a professional coding resource can provide clarity and ensure compliance with coding standards. Additional resources: American Medical Association, AMA, CPT Professional Edition, https://www.ama-association.org/amaone/cpt-codes. Centers for Medicare and Medicaid Services, CMS, HCPCS and CPT coding resources, https://www.cms.gov. This tutorial provides a foundational understanding of how to look up and code for septal button procedures using CPT codes. For further practice, you may consider reviewing case studies or coding exercises related to cardiac procedures.